All right, party people, we are back at it with another one. So, I had some requests for some physiology and medicine basics. So, today I'm going to be running through one of my Substack articles covering white blood cells and a little basic hematology as well as an introduction to leukemia and lymphoma. All right, let's get it. So, the key here is to understand white blood cells first for their function and also how they relate to leukemia and lymphoma development. So we're going to break this down into manageable bite-sized pieces, and hopefully it'll help you understand and kind of get yourself oriented regarding these topics. So think of your white blood cells as your body's military defense force. Now their goal is to defend your body against invaders, such as bacteria, viruses, other pathogens. An important question to consider is what happens when these military agents go awry? So the two scenarios that you need to be familiar with is the first being autoimmune disease. This is when your white blood cells turn against your own body tissue. So they attack healthy tissue and your organs as if they were enemies. The other possibility is cancer. In this case, specifically, we're talking about leukemia and lymphoma. This is when white blood cells begin to divide repeatedly and excessively in an uncontrolled fashion. So we're going to run through the basics and the categories for your white blood cells. Now they come in a few different varieties and each has a specific role. So let's jump into it. Starting with granulocytes. These are cells with granules. Now, when I say granules, I literally mean that you will be able to see visible granules under a microscope. So first and foremost, we're starting with neutrophils. These contain neutral staining granules. These are the most common, most numerous of your cells in circulation. They contain myeloperoxidase, which gives them that greenish appearance under a slide. Next up, we have eosinophils. They contain eosinophilic, aka acid staining granules, and these are important in allergic responses for parasitic infections. Basophils is next up, and these contain, you guessed it, basophilic staining granules. These are involved in the inflammatory process. Jumping into agranulocytes, these are cells without granules. These lack visible granules under a microscope. These will be classified as monocytes and lymphocytes. Monocytes, these have a distinctive horseshoe or kidney-like appearance. They're the largest of the white blood cells and they're precursors to tissue macrophages. The way to think about this is that a monocyte is a macrophage in the blood. When the monocyte is circulating, it's a monocyte. Once it enters your tissue, at that point, it becomes a macrophage. And then depending on what tissue it's in, we have different names for the various macrophages of the said tissue. As far as lymphocytes, these are small cells with very little cytoplasm. When I say cytoplasm, I'm talking about the area within the cell that's around the nucleus. These include both B and T lymphocytes, and it's important to note that you cannot distinguish B cells from T cells on a regular smear under a microscope. They basically look identical. This is why you need specialized techniques such as flow cytometry. All right, so here we have the white blood cells divided into their respective two categories, granulocytes and agranulocytes. So under granulocytes, you can see the neutrophil, the basophil, and the eosinophil. And for agranulocytes, you see the monocyte and lymphocyte. Some of you may be visual learners. This helps in terms of categorization. So we're going to be going over some white blood cell 101. Now, your white blood cells are, again, nucleated blood cells that form part of the immune system and defend your body against those foreign invaders. Now, unlike red blood cells, white blood cells are nucleated. They have a nucleus, while red blood cells do not. Now, key differentiation that needs to be done is between those white blood cells and platelets. White blood cells are complete cells. This is important because platelets are merely fragments of cytoplasm shed from their parent cells called megakaryocytes. Now, where do these cells come from? All blood cells originate from multipotent hematopoietic stem cells. These are found in bone marrow. Now, these are remarkable because they're able to differentiate into all major lineages. The major split is the myeloid lineage versus the lymphoid lineage. Now, as far as the myeloid lineage, these will produce erythrocytes, thrombocytes, aka platelets, neutrophils, basophils, eosinophils, and monocytes. As for the lymphoid lineage, these produce B lymphocytes and T lymphocytes. Please remember, B and T lymphocytes look identical under a standard microscope. These require flow cytometry to differentiate one from another. Here we have a flowchart basically showing the progress from a myeloblast to a promyelocyte. This is the first step where you'll be able to see those azurophilic granules. The promyelocyte then divides into three channels, which are the neutrophilic channel, the eosinophilic channel, and the basophilic channel. Next up, we're going to be getting into lymphoma versus leukemia. Now, before we get into the specifics, let's first understand the circulatory system. So we have to clarify where white blood cells can be found by understanding two interconnected systems. The first part of the system is the blood, aka cardiovascular system. This is a closed system. It starts in the heart and ends in the heart. Let's run through this circuit. So you're going to have your deoxygenated blood, which leaves the right side of the heart. This travels to the lungs for oxygenation. Then the oxygen-rich blood returns to the left side of the heart. This, in turn, is pumped through the aorta to supply the entire body. After delivering oxygen and collecting carbon dioxide from various tissues, the blood returns via the superior and inferior vena cava. This, in turn, ends up back in the right side of the heart, hence completing the loop. Here we have a nice image showing this circulation. I encourage you to draw this for yourself, and in my opinion, it's always better to try and understand what is taking place as opposed to memorizing, because the memory will fade, but your understanding more or less is forever if you're able to create these pillars for yourself and general frameworks that make sense. Memorizing a bunch of random facts is just going to leave you more confused. Next up, let's get this lymphatic system under control. So this is an open drainage system. By open system, I mean it does not form a complete circuit. So how does it work? Let's get it. At the capillary level, blood is filtered. The blood cells remain in the blood vessels. Plasma diffuses out of the surrounding tissues. Most plasma returns directly to the blood vessels. These are the venules and veins. A minority of plasma enters the lymphatic system. The lymphatic system serves as both a drainage system and an immune surveillance network. Now, lymph nodes are specialized structures within the lymphatic system. Think of them as checkpoints where large concentrations of immune cells gather to fight infections and filter foreign material. Here we have a nice image of this lymphatic system. You can see how it interconnects with the circulatory system. All right, let's go over some of the definitions that you're going to need to kind of get yourself oriented regarding leukemia and lymphoma. So as far as leukemia, these are abnormal white blood cells in the blood and bone marrow. Lymphoma, on the other hand, are abnormal white blood cells in the lymph nodes and lymphatic tissues, period. Keep it simple, straight to the point. Here for you visual learners, we have a stylized image of a woman's neck indicating the lymph nodes and the lymphocytes located in regards to her lymphoma, as well as a stylized blood smear indicating leukemia in the blood. Now, in terms of where to look for each type of cancer, the factory, aka the bone marrow is where the blood cells are manufactured. So if we want to diagnose leukemia, we're going to be thinking first, we're going to have a peripheral blood smear. This is the examination of blood under a microscope, followed by a bone marrow biopsy. This is going to be the sampling of that production factory. Now, why do we do both? Well, because leukemia affects both where cells are made, the bone marrow, as well as where they circulate. You have to use your noodle. This isn't about memorizing facts. It makes sense once you think about it and organize yourself. Now, as far as lymph nodes go, I use the military bases analogy, so therefore we have to do a lymph node biopsy. This is a tissue sample from an affected lymph node. Why? Because lymphoma primarily affects lymphatic tissue where these cells normally reside. Here we have a nice image of a woman getting a lymph node biopsy with the aid of an ultrasound in her armpit. Now, another way to help orientate yourself and give yourself some framework for understanding your blood composition is the centrifugation test. This is when you spin blood in a centrifuge, and then you can see each layer separately. Now, to orientate ourselves, let's go through this. Here we're going to have the three major layers. The bottom layer, which is going to be accounting for about 45% of your blood, is your red blood cells. They're the heaviest and the most dense. They will settle at the bottom. This is 45% of the proportions is your hematocrit. It's a measure of the percentage of blood volume occupied by red blood cells. Now, the middle layer, which is less than 1%, this is the buffy coat. This is a thin, whitish layer. It contains white blood cells and platelets. This is why they're called white, quote unquote, blood cells. They appear white when concentrated. And sometimes they can even appear greenish due to the myeloperoxidase enzyme within those neutrophils. Now, as far as the top layer, this is going to be about 55%, and this accounts for your plasma. This is the lightest component, the liquid portion of your blood, and it contains water, proteins, electrolytes, and other dissolved substances. Here we have a nice image showing each of the respective layers and how they kind of break down. So as you can see here on the left, we're going to have the major divisions. That's the plasma, white blood cells, and platelets, as well as the red blood cells. Then when you kind of partition out each layer, here, when you divide plasma, you'll see that proteins account for about 4%, and that 4% is further divided into 60% albumins, 36% globulins, and 4% fibrinogen. The rest of the plasma is about 50% water, and about other solutes account for about 1%. When we get down to white blood cells and platelets, again, it's less than 1%, and less than 1% is platelets, and less than 1% is leukocytes. And as far as organizing yourself for leukocytes, here are the major divisions of how we can partition those out. Now, 55 to 70% will be neutrophils, 20 to 40% will be lymphocytes, 2 to 8% will be monocytes, 1 to 4% will be eosinophils, and 0.5 to 1% will be basophils. And the rest of your blood volume will be RBCs, which account for the 45% of the total. All right, let's run through the CBC and what you're really measuring in a complete blood count. Now, a CBC provides quantitative data about your blood cells, starting with white blood cells, the count and differential, the percentage of each type. Red blood cells, this will give your number, size, hemoglobin content, and platelets, it'll account for the number and size. In a peripheral blood smear, this is a microscopic examination of the blood. A Romanovsky stain or a Wright-Giemsa stain are often used for general purposes. Specific stains may be required for specific diagnostic purposes, but that's beyond the scope of what we're currently talking about today. Now, as far as white blood cell counts, let's run through these. White blood cells account for less than 1% of your total blood volume, but they're critically important for your immune function. The normal white blood cell range is 4 to 11,000. You need to memorize this. And that is cells per microliter of blood. Now, compare this to red blood cells, which is in the millions per microliter. This is extreme difference based on what is needed for your body tissues to be oxygenated as compared to what needs to be happening for fighting infections. Now, abnormal counts and the terminology. When I say leuko, I want you thinking white. Penia means deficiency or decrease. Therefore, leukopenia is too few white blood cells. Leuko, again meaning white, cytosis means increase in cells. Therefore, if I say leukocytosis, you're thinking too many white blood cells. So leukopenia is less than 4,000. Leukocytosis is above 11,000. There's a few ways by which you're able to organize these white blood cells. So you can go by cell lineage. If I say myeloid cells, we are talking about neutrophils, eosinophils, basophils, and monocytes. For lymphoid cells, we're talking about B cells and T cells. If I was to organize by structural features, we can go by granulocytes. Those are the ones that contain granules. If I say granulocytes, we're thinking neutrophils, who have neutral granules. Eosinophils contain eosinophilic or acidic granules, and basophils, which contain basophilic/basic granules. Next, I could also say agranulocytes. These are the cells that lack granules, in which case we'd be talking about monocytes and lymphocytes. Now here we have to clarify a common point of confusion, namely agranulocytosis. Students often get confused by the term agranulocytosis, so let's clarify. Does agranulocytosis mean the agranulocytes are increased or the granulocytes are absent/decreased? The answer is that for agranulocytosis, we are talking about a decrease or absent granulocytes in the blood. So let's break the term down. A meaning without or absent, granulo referring to the granulocytes, and cytosis means the condition of the cells. In practical terms, agranulocytosis is essentially severe neutropenia. That means low neutrophil count, since neutrophils are by far the most common numerous granulocytes. The key here is not to confuse agranulocytosis, which is low granulocytes, with agranulocytes, which is the cells without granules. I understand that this is a little bit weird in terms of nomenclature, but we have to keep ourselves organized. All right, let's spin the block. So, first and foremost, white blood cells are your body's defense system. Nucleated cells derive from bone marrow stem cells. They come in 5 main types, which is neutrophils, eosinophils, basophils, monocytes, and lymphocytes. Granulocytes have visible granules. Agranulocytes don't. Leukemia is the abnormal white blood cells in your blood and bone marrow. Lymphoma is abnormal white blood cells in your lymph node. Your normal white blood cell count is between 4 and 11,000. Flow cytometry is needed to distinguish between B and T lymphocytes. Understanding the difference between closed cardiovascular system and open lymphatic system is crucial for understanding where these cancers occur. All right, that's going to wrap up for the basics regarding white blood cells. If you like the video, comment, share, subscribe, and check out my Substack, linked in the description box below. Now go crush it.